commissioner over the whole health department operation. Also, you look at her, I remember she had 3 little ones all at one time, triplets.
Wow.
And she got them all, they're 17 years old now, it's hard to believe. 14 years old, it's hard to believe it's been that long.
They were 4.
Okay. All right, again with that, I'm going to introduce Jamie. She's going to do a little presentation. Jamie?
Thank you. Yeah, that's the number one thing that whenever those things were like something that people don't know about you, that's what I use usually. The health insurance for the county went up the next year, probably because of me. Thank you, Otto. Thank you for having me. I made a comment earlier that I could talk about the health department every day, all day long. So I will try to limit my time. And I did have a PowerPoint presentation that I brought with me to set up, but I didn't expect 2 construction delays on the way over here. So such is public health. I kind of pivoted and I'm not going to use it, but I will go off my original presentation. So as Otto said, I've been at the health department for almost 17 years and in the health commissioner role almost 3 years. We are a fairly younger staff. We've had a lot of retirements in the last few years. Laura Caressel was our director of nursing and Kim Moss was our health commissioner, and they both retired on us just about the same time. And so myself is in the health commissioner role, and like I said, almost 17 years. I started out as a public health nurse. My background is in nursing. I went into a health promotion role, and then up into the health commissioner role. Stacy Lucas is our director of nursing. She's been with the health department just as long, maybe 19 years almost, and she was a public health nurse and is now in the director of nursing role. So we are a fairly younger staff, which is exciting and have lots of energy and lots of new things that we're doing in public health because it is ever changing. So just to start out with what our mission at the health department is, we just redid our strategic plan, and so our mission is to promote and protect the health and well-being of all people and places in Defiance County with a vision of having a healthy and safe Defiance County. That was really something we really wanted to look at this time around with our strategic plan, is looking at our vision, looking at our mission, and making it appropriate for what we're doing, and also looking at our core values, because that at the health department is something we really strive for, is to have values that are consistent with the county and consistent with what we're doing. So our core values is we educate, we collaborate, we empower, we respect everyone, and first and foremost, we make a difference. So when I had my PowerPoint presentation, I had a little 2-minute video on public health, and I don't have it, so I'll kind of just let you know what it does. So imagine this music like dum 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 dum. I mean, it's very dramatic music, and it talks about what if we lived in a world where we didn't have clean water, where there was sewage all over the place, where toxic waste was in our backyard, where our average age of death is going down, 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 and where it's just not a safe place to do anything like running or like bicycling. And then it kind of switches and it goes doo-doo-doo-doo-doo-doo. And it's like, but we don't have to live in that world, and that's because of a lot of things, but public health is number one in trying to make a world where we have clean water, we don't have sewage sitting on the ground, we don't have toxic waste in our backyard, and we're making sure that, as in our vision, it's not only a healthy place, but it's a safe place. Because if we're going to run, and if we're going to get out and do all those things that our doctor says we need to do, we need to make sure we live in a safe environment to do that. So just a little primer on public health. We are guided by 10 essential services of public health. And so a while back, there was a study that said if you've been to a health department, you've been to one health department, because every health department was different. And so there needed to be consistency within what we're doing. So the first thing they wanted to do was to create these 10 essential services of public health. And that's really what guides us in the services that we're performing. A lot of it is about investigation, looking at communicable diseases, looking at chronic diseases, and trying to figure out if there's a source to it. Kind of back in history, there's a slogan that we have, or like, the keep calm, and it's keep calm and remove the pump handle because there was a cholera outbreak and there was tons of people with it and they were trying to figure out what was going on with it. And so they ended up plotting where all these cases were, and what they realized when they plotted it all out, that was related to one water pump. And so what they did is they took the pump off the handle so people couldn't get water out of that water pump, and the cases went down. Early public health, that's what public health is about, is recognizing there's an issue, figuring out what's causing that issue, and creating a solution. And that's essentially what those public health services do. The other big thing that we do is collaborating. So we had someone say it best that we're neutral conveners, and we really are. We can bring lots of people together who might have different views on a subject. Everybody wears things through their lens, and we bring everybody together to look at a problem and figure out what are solutions. So how do we know what to do? As I said, with epidemiology, we're very much looking at what does the data say. And so we have 3 pieces that really guide what the health department is doing. Now, don't get me wrong, there are things that we need to do, we have to do, because the state tells us we have to do, or the federal government tells us what we have to do. But we also have to look at what's going on in Defiance County, because what we see in Defiance County isn't what's happening in Lucas County and vice versa. So we have to be cognizant of what's going on with us. So the first thing that we have is our Defiance County Health Status Assessment. This has been going on since 1997, so we've been doing this for a very, very long time. We do this in conjunction with a lot of partners. We have a coalition called Power Defiance County. Power is an acronym because we love acronyms in public health. And so it stands for Promoting Overall Wellness and Empowering Residents. Every 3 years we do a survey. We send out surveys to adults. We survey the youth in our schools, 6th through 12th grade, and we also send a survey out to adults who have children 0 through 12. It asks a variety of questions because this is a report, so it's lots of pages, lots of data. It talks about what their health practices, what are their health access, what are their behaviors, what is their insurance status, and gives us a great report of what's going on countywide. What we do within this Power Defiance County is we look at this data and we say, okay, what are some topics that we really want to hone into that we feel are really affecting the residents of Defiance County? We select those and then we come up with a plan, and that's our Defiance Community Health Improvement Plan. So this is a plan that everybody, all of our partners have agreed upon that these are the things we want to do to address those problems. So we just did this again in 2018, and the areas that we're addressing as a community or as a county are chronic disease, specifically looking at obesity. So yes, I do agree that you probably should have charged $1 for those who aren't running. I love that thought. That's very public health minded, thank you. We are looking at mental health and substance use, and we're looking at injury prevention. Specifically in injury prevention, we're looking at safe sleep. So making sure that children are in a safe sleep environment, so we're decreasing the amount of infant deaths. We're looking at child passenger safety. So making sure kids are riding in passenger seats to decrease, because that is the #1 cause of injury related to death in children, is motor vehicle crashes. The other thing we're looking at is senior falls. What we're seeing in Defiance County is the amount of older adults above the age of 65 are falling, and we have a pretty high mortality rate on that. So not only are they falling, but our deaths related to falls are high. What we're seeing is that number going up. We're also seeing, we have some data with our EMS that says that if someone falls in their home and the EMS is called, they're not being transported on, they're just getting lifted back up, and then they're getting called again and again and again and again. So what we wanted to do is address that senior falls. And we have a program that's called A Matter of Balance that is geared to seniors who have fallen. One of the biggest predictor of subsequent falls after an older person falls is the fear of falling. I fell about 5 years ago, right before I went to a falls conference, which is irony at its best. Cracked my head open, had to get stitches, had a concussion, and I can tell you there was definitely a fear of falling. I was so careful when I walked, and so what happens when you're an older adult is your fear of falling, you're not as active. active, so then your muscles atrophy, and then you're at even more risk of a fall. So our program that we've started is about trying to reduce that fear of falling and also having some exercises to strengthen your muscles, strengthen your bones. So that is all on a county-wide data. One of the things that we did not too long ago is we created a health equity report. This report is looking at census tract data. So what we're really gearing at the health department is we talk about health, and what we standardly know as health is we go to the doctor, we see what our cholesterol is, we see what our blood pressure is, we see what our weight is, and we talk about those numbers. What we're realizing is about 70% of what makes up our health is actually our socioeconomic factors, so where we live, and also our health behaviors, which are driven by our socioeconomic factors. So we really did a deeper dive in that, looking at census tract data. So census tracts are smaller areas that you can whittle down in the county, and we looked at census data to say, okay, in this census tract, what is the average income? What is the amount of poverty? What is the amount of, what's the education level? All these things, and we tried to see if there was any correlation between these factors, and then we took our average age of death for those census tracts to see if there was a correlation. There was. So what we found in Defiance County is our east side in the city of Defiance has the most disparities, meaning they have the lowest income, they have the highest amount of poverty, they have the lowest education, highest number using food benefits, and their average age of death was about 71 versus North and South Defiance, which was 78. So in the same city, you have a section that is dying 7 years younger on average. And not only are they dying 7 years younger, they're dying at a faster rate. So that's a huge thing to us to say, okay, what do we need to do for this? And we need to look at things a little differently. So public health, we are a public health department, we are public health, but we don't do it alone. We have a public health system. We have to all work together to make sure we're addressing the health issues. So healthcare providers, we need to make sure we're looking at infrastructure. Are there sidewalks? Are there safe places to walk, to recreate? We need to look at jobs, so we need to work with economic development to make sure people have a steady income to be able to go to the doctor, to be able to buy fresh fruits and vegetables, to be able to have transportation to the grocery store and back. So these are all things that we can't do alone. We really reach out with everyone to try to make a difference. So I have a little activity. A lot of times people aren't aware of the breadth of everything that we do at the health department, and we really, really do a lot. So we have some general divisions. We have our community health division, which includes our nursing staff, and our WIC department, which is our women, infant, and children. They are a supplemental food program. We have our environmental health division, and they do all things environmental health, which we'll talk about. And we have our administrative division. So this is our health promotion. We go out and we educate on promoting health, but also we have our chronic disease epidemiologist who gives us a lot of that data and that very, very rich, great data regarding the social determinants of health. So raise your hand if you could, if you drink from a private well. So if you drink from a private well, please raise your hands and keep them raised. Okay. Ready.
You don't have city water, do you? You do private well?
Okay.
How about a pond?
Well, there's a good question. Does that include ponds?
Yeah. That's all right. You'll raise your hand.
How about the river?
Let me keep going. Raise your hand if you have a home septic system, which is probably everybody who already has their hands raised. Okay. Raise your hand if you've seen one of the health department's billboards or a social media campaign of ours. Okay. Raise your hand if you know a third grader in Defiance County. Okay. Raise your hand if you know an older adult who has fallen in the past. Keep your hands raised if you would, please, if you've already done it. No, raise your hand if you know someone who receives WIC benefits. Okay. Raise your hand if you know someone who's received a vaccine from us. Raise your hand if you ate at a Defiance County restaurant in the last month. Okay? And raise your hand if you needed a birth or death certificate. So I think everybody raised their hands. So we have a lot of services, and really it does affect every single person in Defiance County. So just to go a little bit through those again. Our Environmental Health Division does look at wells. They permit wells, they look at wells, they test well water to make sure that everything is good to go. We actually had, this was the second year we came to Hicksville, and we had a well water testing event during Surface Groundwater Awareness Week, and so people could come up to Community Hospital, bring a well water sample to get it tested. We do also permit and license septic systems, which is kind of a controversial issue right now because we do have a new program called the Operation and Maintenance Program. It is a program that is coming down from the state, but it is a very good program. It's a program looking at making sure that there aren't failing septic systems that are causing a public health nuisance, but also making sure, one thing we've learned in implementing this program is the span of knowledge regarding septic systems, especially if you have a septic system, is very great. You have someone who never knew they needed to pump their septic system to someone who knows everything and does their own maintenance on their septic system. This program is really about making sure we are, as a health department, know about all these septic systems, but everybody knows how to maintain it. So hopefully we're saving you money so that septic system doesn't fail and cause an issue. The other thing that the Environmental Health Division does is we do restaurant inspections for every restaurant in Defiance County, so we're making sure that the food going out is safe and we don't have any foodborne illnesses. We look at swimming pools, we look at campgrounds, we look at manufactured home parks. We do lots of different things for the environment, and that really is why we said within our mission statement this year that we want to make sure every person in place in Defiance County is protected. Our big thing is pushing out social media and pushing out education regarding promotion of health topics. So we are definitely available to come to schools, to come to groups like this, to come anywhere to present presentations on a health message. Third graders in Defiance County, we have a partnership with the Adams Board of Defiance County and United Way of Defiance County. We do a My Plate presentation for third graders. And it's a really easy way. So when I grew up, you had the food pyramid, and there's been definitely different iterations of this. This is a really simple way of looking at your plate and saying half of your plate should be fresh fruits and vegetables, a quarter of it should be a lean protein, and a quarter of it should be a whole grain, and then you should have a dairy. So a very easy way of looking at what nutrition should look like. So we go into the third grade classrooms and we talk to them about the My Plate and good nutrition. As I said, older adults who've fallen in the past, we have the Matter of Balance program that addresses that. We have our WIC program, which not only has our office in Defiance, but we have a satellite clinic in Hicksville that we come to once a month. We do immunizations. That has changed for us. We used to give immunizations to anybody, but changing in funding has brought us to where we only give to those who do not have insurance or who are on Medicaid. All of our providers, for the most part, within Defiance County give immunizations, so the need wasn't there for us to bill insurance like all the hospitals and doctors' offices do. However, Hicksville is a pocket of need for us because the doctors here don't do that Vaccine for Children's program, which is for those without insurance or Medicaid, so it is important that we come here and do that satellite clinic. And we have our vital statistics. So if you need a birth record or birth certificate or death certificate, we're where you need to come. So just to give you an idea in Hicksville, the amount of hours that we've served here, in 2018 we were here for 857 hours, and so far in 2009 we were here for 710 hours. So we are very active in Hicksville. We are here quite often, once a month for WIC, once a month for immunizations. And that kind of changes based on need. If we see a need, then we'll come here more often. And also, like I said, with environmental health, one of the things we also look at is nuisances. If they're a nuisance within the county, we can help to try to figure out if there's some sort of jurisdiction that we can have some enforcement on, or get the people together to take care of it. So a couple upcoming things that I wanted to let you know about is we are currently celebrating 100 years of public health as a state. but our 100-year anniversary for the health department is coming up on March 20th. We have some amazing historical records at the health department. We have the actual first meeting minutes of our first Board of Health meeting. And so it's pretty cool. It's been fun to go back and look through all of that stuff, so we'll be looking for stuff on that. The other thing that's coming up is, I said earlier that there was a lot of committees who met and decided that if you've seen one public health department, you've seen one public health department. Well, one of the ways they're trying to resolve that is by creating national accreditation. So public health's never been accredited. There was never an accrediting body, and they developed that. We started on the accreditation journey about 5 years ago, and what we wanted to do is make sure that it was ingrained in our culture and making us better. Long story short, we applied for accreditation in 2017 and finally had our site visit in 2019. We have our report back, but we're waiting final status of accreditation, fingers crossed, in November. But I can tell you and brag about, because it's pretty amazing that we as an agency were able to, out of 100 standards that we have to meet, 96 of our 100 standards we either fully met or largely demonstrated. So we did very well, and we're really excited, super proud of all of us, because it really takes all of us to do that. The other thing I wanted to mention is we do have a levy on the ballot this fall. It is a 1.1 mil renewal levy, so it's just a renewal, no new taxes. But I did want to make you aware that you will be seeing that. In 2018, about 41% of our funding came from our levy. We are not well funded from the state. We get about $10,000 a year from the state. So our levy is our main funding source to be able to do all of the things that we talked about. And with that, I wanted to leave quite a large amount of time to be able to answer any questions.
Measles. Any cases in Defiance County?
Nope, no cases in Defiance County. It is something that we're definitely keeping our eye on. And we've already, part of what we like to do is be prepared. Emergency preparedness is another huge thing that we do, not only for measles or influenza or an epidemic, but we definitely are prepared. We have stuff ready to go should that happen, to get out to the schools, but it's definitely something that we're keeping an eye on, but nothing in Defiance County.
Back to the septic. What reason would, how does the owner call you and say they want it checked, or do you have an issue that you go to them?
It can be one way or another, yes. If you can call us, and I have information on our operation and maintenance program. With this program, you do, as a homeowner, you have to get a permit to operate your septic system. And then what you have to do once you have that permit, it's $60, and then in 4 years you have to prove that you had your tank inspected and maintenance. So you either have it pumped, or you have the inspector say it didn't need pumped, or you follow a schedule. So yeah, sometimes we get a call saying, there's sewage on the ground, we think there might be an issue, and then we'll go out and we'll inspect, or sometimes people just call us. Now with this program, you don't have to have us inspect it. There's a couple different options. You can have us inspect it, you can have a contractor, sewage contractor, come and inspect it and pump it. Or the other option we have is for you to become certified to inspect your own tank. So there's a few different options to be able to do that, and that was really important for us when we were developing this program. Number one, it doesn't mean that you're going to have to get a new septic system, and that's a lot of what we're hearing. As long as it was installed according to the regulations at the time it was installed, and as long as it's not creating a public health nuisance, you don't have to replace or repair your system. So what we're doing for the O&M program, is we're bringing it in 3 townships at a time, and we were purposeful on how we're doing that. We're doing it based on the river and the watershed. So, we've had the algal blooms within the river, and so we want to take a watershed approach to hopefully clean up the rivers, or help to clean up the rivers. And so the first go round was this year. We did Defiance, Noble, and Richland, and then it'll be Adams, Delaware, Highland. Hicksville is in our 3rd round, which would be April 2021.
I wasn't asking for my place here in Hicksville, but for my place, another place I own, and it's in another say,
Mm.
for a while, they changed it because it caused so much issue, but you couldn't sell your home without having it inspected and proven that you've done all the updates. So a
Mhm.
lot of people couldn't sell because they didn't have the money to do the updates. So I was just wondering how you did it in this area.
Yeah, and I think, and this isn't the guys could answer this a lot better than I can, but a lot of times it depends on what kind of loan you're getting and whether that septic system, if you need an inspection of it. Other questions?
That $60 operating permit, does that time frame that
4
these
years.
inspections go also do that in like the Hicksville townships in like the third round?
Mhm.
Do they need to be getting that thing out? They have to like 2020 to get
Right.
it, correct? Okay.
Yeah, so come 2021 for Hicksville, what we do is we'll send out an information packet that has a permit. We are also having a town meeting for those townships that are coming in, where we'll present the information, give some more information. So no, you won't need to come in until 2021, and we'll send out information. Yep. Yeah.
You do anything for the dental at all? I noticed there wasn't dental in here, but there was vision.
So, dental is definitely on our radar. We have no dentists within Defiance County who accept Medicaid, and that's been on our radar for a long time. We actually just met with people from the state to talk about dental, so we met with the Department of Medicaid, Department of Dental Association, some professors, Oral Health Ohio, to talk about the fact that we have no dentists in Defiance County. We have the FQHC in Bryan that we generally refer to. However, there is a huge waiting list, like 6 months out. So it definitely is a need. So no, we do not, is the short answer, but it's something that we're looking at. And there are some possibilities within Defiance County of people wanting to get dental things going. What I heard loud and clear is at this meeting is it's a lack of dentists. And that even though we have quite a few dentists, they're all very, very busy. So.
Thank you.
I have two questions. You talked national news more, but the mosquito epidemic that was going around, I know our state was kind of the deaths, people were some in Michigan, and also the vaping issues going on nationally. I think they're kind of prominent right now.
Yeah.
But is that something you help? I know national attention, but even local.
Yeah, no, absolutely. We're definitely keeping an eye on it. That EEE was up in the Michigan, but even West Nile, we actually had a really low year this year. The state decides where they're going to have mosquito pools that they're going to test for West Nile, and Defiance was a pool site this year, and none of ours tested positive, so it's pretty low with that. We haven't gotten much out from the state yet on the EEE, but definitely it's something that we look at. We also, this year and last year, we did partner with the city of Defiance to provide larvicides to anybody in the county. So if they had standing water, they could come and get the larvicide and put it in the standing water. Standing water is a harbor for mosquito breeding, and so you put the larvicide in there and it'll kill those. So something that, yeah, we're looking at. Vaping, absolutely. Ohio Department of Health is monitoring every week the amount of the severe lung disease that they're seeing with the vaping. We actually started with our hospitals asking them to report any sort of respiratory illness where they were a vapor before they actually started tracking it. So, so far nothing yet with us, but it's definitely something we're looking at. The other thing that we have is a drug-free coalition that initially started at the health department and then moved out to a separate 501c3, and now it's back to the health department. So we're actually just talking about vaping with the drug-free coalition as well. The biggest thing for any substance that we like to talk about, especially with our youth, is to really start talking to your kids. Sometimes we think that if we talk to our kids, they're going to be more apt to do it, and that's actually vice versa. What research shows is if you talk to your kids about this and the dangers of it, they're less likely to engage in that risky behavior. So yeah, definitely something that we're looking at and we'll be pushing out information on. unfortunately, the data is, you know, they're still trying to figure out, even with the vaping and the severe lung injury right now, you know, they feel like a lot of it is related to vaping that has THC in it, but they can't make that causal relationship just yet because the data is just coming in. It's scientific research isn't there. Yeah. Any other questions? I love the World Polio Day. I think that's super exciting. My dad actually had polio when he was younger, and one of his legs is shorter than the other, and he has no muscle mass in it. So it's definitely a physical reminder for me every time I see him that, you know, it definitely can affect people, and it's a great thing that we have all these vaccines to prevent that. Okay, well, thank you very much. I appreciate it. And I do have information on the operation and maintenance program if you'd like any. There's frequently asked questions, there's a brochure, and we have a lot of information on our website. Cool.